So today with Dr. Gavin Macgregor Skinner, we're going to talk about vacuuming. Everyone has pushed a vacuum back and forth, and we all know how important it is to vacuum on a regular basis to keep the carpet clean and the rugs clean. But Dr. Macgregor Skinner, with this pandemic, I think you have seen some necessary changes that need to be looked at when it comes to vacuuming in especially hospitals, nursing homes, and medical facilities. Tell us what you're seeing and maybe some of the things that we need to be aware of.
Well, Jeff, it's definitely not a new topic for conversation. I've been working in hospitals now for a very long time, working on programs for infection prevention and control. I think what a lot of people will be surprised about is the amount of carpet that's in hospitals. When I start working in assisted living, veterans homes, nursing homes, the amount of carpet that's in those facilities. And the big gap, the big need I see right now is a number of people, they've used their vacuum cleaner to, pick up soil and dust in the past without thinking about how can it be used to minimize contamination from an infectious virus or other pathogen. And so what I'm seeing now is that some facilities have stopped vacuuming altogether, and those facilities are getting quite dirty. Some haven't worked out how then to go from vacuum to something else. And there's a big gap in knowledge and education about whether we use a high efficiency particulate air filter, a HEPA filter, and what it can and can't do, or whether we use a vacuum without it, or what time of day would be best for vacuuming has been a topic for discussion in so many of these facilities.
Yeah, I imagine that when you do vacuum in facilities that especially with a beater bar system, you do have a little bit of airborne particulates that are a result of that. So people probably should be out of the room for that. Tell us about the CDC. I believe that this isn't new to them. Do they have any guidelines?
Yes, so we've been dealing with, again, cleaning, disinfection through a lens of infection prevention and control to minimize contamination within hospitals and healthcare facilities for many, many years. So this is, as I said, this discussion about cleaning, but also discussions about vacuuming is an old one. The challenge we have is that it's not a well thought out one. And so you'll see a lot of people say, well, you can vacuum as normal. Well, what does normal look like? There are so many different kinds of vacuums out there. There are some with HEPA filters and some without them. There are so many different filtration systems. There are so many different types of bags. And again, so you've got to look at, it's a bit like, if you went to surgery, do you want me to use a butter knife, a steak knife, or a sterile surgical scalpel? There's that many varieties of things that could cut you open and do surgery on you. We've got the same paradigm of complexity when we look at the number of vacuum cleaners out there. And what I'm seeing on the guidelines from the CDC and other government agencies is that vacuum as usual with a little asterisk. And if you don't click on that asterisk, you don't say, well, the operator needs to wear the proper personal protection equipment if you think there's a risk of SARS-CoV-2, the virus that causes COVID-19. Then they need to be trained on how to put on that PPE safely and how to take it off safely. Then they need to be trained on how to clean and disinfect cleaning equipment like the bottom of a vacuum cleaner, like the handle of a vacuum cleaner, which becomes high touch. Do they wear gloves when they vacuum, or do they not wear gloves? And there's these simple fundamental questions there that need to be addressed through training and education, which I think that the GBAC STAR program will be focusing on. But again, necessary gaps. But again, it's consistency and taking things to scale and not just doing it because it's what you used to do.
No, that's fantastic. I would imagine that things are going to change globally with cleaning equipment, making sure it's clean. I know that I've been around many vacuums that have been switched on, and you smell that terrible odor coming from the filter system, the vacuum bag. That has to stop, I would imagine. That would be a recommendation from you. I could see that.
Well, this is the situation that we're challenged with as we go to really strengthen infection prevention control and minimize contamination through proper cleaning approaches. When you turn that bag on, Jeff, if you didn't smell anything, you wouldn't think there was any air coming out of it. So one of the things I do is I educate, I teach adults, and adults learn by doing. And I'll say, turn the vacuum cleaner on. Do you know there's air coming out of it? I can't see it. What do you mean, Gavin, there's air coming out of it? So I get a series of incense sticks, and I light the incense sticks, blow them out so we've got some smoke, and then I can hold the smoke around the vacuum cleaner. So when you turn on, you go, oh, look at that. The smoke went and moved all over the place. That means there's air coming out of the vacuum cleaner. And people go, oh, I didn't realize that. Well, let's try this other vacuum cleaner. Oh, there's air coming out of that vacuum cleaner. So you actually have to use a tool, which we have in the toolbox, to visualize the air movement out of the vacuum cleaner, and how then we can then translate that back to the possible movement of virus particles that could infect you with a disease like COVID-19. And if you don't do that sort of hands-on training, that visualization, then people don't realize, oh, now I have to do my risk assessment and work out how to solve this problem.
I never thought that talking to you would make me want to go buy incense sticks, but
Oh, look, talk to me about incense. So I know nothing about it. All I know is I can light it and they make
That's-
smoke, Jeff. That's about all I know about them.
it has smoke. Yes. Well, great advice, Gavin. And I'm glad to hear that the CDC has looked into some of this, because as a global issue, we need to think about cross-contamination and using the equipment that we have and keeping it safe. So appreciate all you're doing.
I think the next steps for us, Jeff, is we're going to look at again the types of vacuum cleaners and in what situations we can use them through a lens of risk assessment. What time of day should we vacuum? Again, the recommendations we've made for years is people shouldn't be in the room when you vacuum. And again, what sort of level of personal protection equipment does the house cleaning staff, the user of the vacuum, need to wear when they empty the bag as well as when using the vacuum? But more importantly, how do they take that personal protective equipment off safely? And that's the pathway we're taking right now.
Yeah, lots of steps and procedures to consider. It seems to me like if someone's vacuuming in a room, it's not too big of a deal to have everyone leave for a few minutes while that work is done. It's safer and it's better. So, well, Gavin, thanks for your time, and we'll catch up later.
You're very welcome, Jeff.